Here we are with our patient Alvaro. Alvaro just stopped by for a 9-month follow-up, and we are looking at an unbelievable result. I have a patient behind me that everyone's probably going to recognize this guy.
How's it going?
That's the superstar Ryan. Everyone comes in and says, can I get either the Aldo or the Ryan? Now I think they're going to be asking for the Alvaro too. Man, so we did Alvaro's procedure 9 months ago. We did one max harvest hair transplant procedure. And what we did for Alvaro is we did we hit his crown, we hit the hairline, and then we blended everything in. So we'll show you how his progress is doing. And then we'll show you the suture line. And then we'll talk about what he's doing as far as preventive treatments and things of that nature. First of all, how was the process for you, my friend?
Incredible. Everything went beautiful. I actually literally had no pain, to be honest with you.
Wow.
I didn't even take a Tylenol. So the original process of the surgery went fabulous, and as the grow out just went, everything is playing actually way beyond my expectations.
Wow. I get patients that are literally coming in from all over the world right
Sure.
now. And they're all saying these people are paid. I'm paying everyone to do these videos. Mm-hmm. Were you paid to do my video, or am I paying you to be here today?
No, unfortunately, no.
Okay.
This is all
okay.
Exactly what it's supposed to be, and you've done an incredible job. I have compliments every single day. I own a hair salon.
Awesome.
I have clients from myself as well as my staff that sometimes haven't seen me in months, and they're just blown away. They actually have to look twice to see if I'm the same person.
I just did the same thing. When I saw you, I truly didn't recognize who you were when you walked in. I haven't seen you since you've grown out, and you look amazing.
Thank you.
I'm so happy for you. Let's show you what we did. I'm really pleased with his results. Brian, come on in here, man. I would like to put you in here as well, because I want you to look at this with me. This is one of our superstars right here, Ryan. And I'm not kidding you. Everyone calls up and they say, I want the Aldo or I want the Ryan. All right, so I haven't looked. I want you to take a look on the suture line. Show me where the suture line is on this patient. So this is our patient Ryan, trying to find our suture line on our patient Alvaro. Dig through there, buddy. Don't be afraid. Move that hair around.
Yeah, I can't see it. Yeah, there's nothing. Yeah, I mean it's totally hidden. You can't see anything.
So Ryan is a hair transplant recipient, and I had Ryan try to look for a suture line, but now I'm going to show the camera where it is, so let's take time to take this camera. When we do the max harvest hair transplant procedure, we're always wanting to move as much hair as possible. So we start from one side and we go all the way around to the other side as far as we can go. So I'm going to just kind of spin our patient around here, okay? And we recreated the hairline, we filled in the hairline, then we filled the crown. We'll show you that in a second. Come on over here, sir. Okay, see that?
Wow, it's so fine.
See this? Let me come on this side so here. Okay, so this little white line here, it starts here. Can you see that, Josh? That little line, and I will do this with any patient. I show the camera and the suture line at the same time because I'm confident with my work. That's a suture line from one procedure. Okay, now let's kind of follow it around. You see that little line? Alvaro, will you tuck your chin down, please, a little bit? Thank you, sir. Down to your chest a little bit, thanks. Okay, so this is the suture line. Let me get that. Pretty cool, huh, man?
Yeah, that's amazing.
Isn't that cool? So we had Aldo in here the other day, and I did the same thing to him, and he couldn't find it out either. So you got to really know exactly what you're looking for. And Ryan's very educated with hair transplants now. He's such a good sport, comes in all the time and talks to all of our patients for us. And you know, it's crazy. These guys are seeking out something called follicular unit extraction. I know you know all about it. Where they're pulling the little holes out of the back of the head, trying to get a scarless procedure. And for what? I mean, you know, this scar. It's undetectable. If it's done properly and the patient's a good patient the way Alvaro was, you'll never see it. I mean, look at that. As long as I have Alvaro back like this, I'm going to show the crown off. I'll kind of tilt your head back, please, Alvaro. Excellent. Okay, so check this out, man. We did a crown on you, right? So the crown is where we build in the spiral. I'm going to move the hair the way the hair wants to naturally go. There's a spiral here. These hairs are angling in this direction. This is going this way, and this is going this way. Patient was just styling it that way just because that's how it was. He wasn't doing a comb over. But look at the difference. That's just how it naturally, that's even going against the spiral, and look how nice that's falling. That's one procedure. I tell each and every one of my patients, I like to have 2 procedures in the same area for what I like to call a finished product. Due to the constantly changing direction angles of the hairs in the crown, there's only so much density you can get from that one procedure. Unfortunately, we just keep on losing hair, and that's part of the process. And then if you kind of just tilt back a little bit, everyone always says put a comb through it. Here you go. Here's a comb. So here's combs, plural. So nothing jumps out at the eye, you can't see anything. Nothing's detectable. And it just looks like it's his natural hair because it is. We're just taking that hair from the back and we're putting it up top. And now I'm going to just kind of show off your hairline here, sir. Meanwhile, this came out phenomenal. Suture's like on the mark.
Yeah.
So we recreated all the hairlines, tiny little 1-hair grafts all the way around the front to reframe the face, made it nice and kind of squared it off with lower recessions to give him more of a youthful look. When you see Alvaro's before pictures, he's going to look 10 years older, and it's the same guy. Just by reframing the face and shaping it, he looks 10 years younger. Same thing with Ryan. When I met Ryan, I thought Ryan was in his mid-30s, and he was in his mid-20s. So it's tiny little grafts all the way around front, little strong ones behind that, down the center to tie it together. We did that one procedure, and that's its result. I always recommend a second procedure just due to the fact that I know what I can do on the second procedure as far as filling it in, closing it off, and finalizing the product. However, it's not required, and that's it. Congratulations, man.
Oh, absolutely. Thank to you.
You're welcome. Is there anything you'd like to say to the potential patients or patients that are out there?
Oh, absolutely. Anybody that's considering or getting their hair thin, don't even think twice. I actually waited way longer than I should have because I was trying to find the right person, and I did. And wait, thank God I did wait. I come and see the doctor because he's absolutely, Dr. Bolton is phenomenal. I mean, the work speaks for itself. The results are amazing.